What is this stand and down? Give this below. You have to come. See if you can come and touch. I have to take that out. Hey, our entry point, you are below our entry point.
Can you talk about the procedure you were doing?
The procedure which you just witnessed is in a percutaneous tracheostomy. It's been done in the ICU. These people requiring long-term ventilation, people not able to come out of the ventilator in the near future. Just to help them to come off the ventilator, we do the tracheostomy. So they can be tracheostomy can be done in theater as well as in the ICU, which with the technique is percutaneous tracheostomy. We use the bronchoscope. So normally it is our physician assistant does the bronchoscope, and I do the percutaneous tracheostomy, or my colleagues, other colleagues do the percutaneous tracheostomy. So the basically bronchoscope is put through the endotracheal tube. You put the bronchoscope and you identify the trachea and give the location for the needle to go via the percutaneous route. So we put the percutaneous route here. So from the bronchoscope we confirm we are in the right place. We are not in the wrong sides, and we are not puncturing the posterior wall. So it helps to identify we are in the right place. So we put the guide wire, and then it throughout the procedure is been monitored by the bronchoscope. You can do it blindly also, but the complication rates are very high when you do it blindly. So when you do the percutaneous technique, those complications are very, very, very less.
And how important is the PA to be there for you, and how much easier do they make it? Or?
Not only this particular procedure, but they are tremendous help, because the theoretical knowledge is as good as MBBS doctors, because they do 4 years. In that 4 years, the syllabus, if you go through the syllabus, because I'm one of the trainers for them, so that the syllabus they have undergoing is much similar to the MBBS, the doctor's undergraduate training. And moreover, it is focused, and it also includes the other aspects which is not taught in our medical curriculum, like resuscitation and about triage and patient discussion, communications. My physician assistants, they do a lot of the follow-up work, where after the resuscitation, patient comes to the ICU, we do all sort of definitive procedures. When they go back, they follow up them in the ward. Not only about their medical needs, but also about social needs and their rehabilitation, mobilization, physiotherapy, supportive therapy. They do a multiple role, and in fact more of my patients know them very well than me. So that is the kind of rapport they have, these patients, relatives and patients.
Can you talk about what you do and your role you play?
We are coming morning and doing a rounds in ward. We'll go and see the patient pulse, heart rate, pulse, BP, and auscultate that patient, and we see the chest x-rays, and we see the blood reports also. In early warning score also we seen. Once early warning score is low, in anything has happened, we inform to our doctors, and the patient, any sick patient is involved, we shift the patient to an emergency department.
And how is that? How does being able to be a PA and contribute, how is that?
I'm very proud of you, because I'm a physician assistant. I'm doing a good job here. I'm doing a good work to my patients also. That's what main thing. I'm very happy to work physician assistant.